Welcome, everyone. Thank you so much for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maximum Eleanor Blum Patient Family Learning Center at Mass General Hospital. Before we get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Please note that everyone is in listen-only mode. Everyone has been muted so that I can hear our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you to help us complete. Your feedback is important to us as we plan future programs. So next, I would like to introduce you all to our guest speaker, Lindsay Ventura. Lindsay is a Senior Clinical Research Coordinator for the Liver Center at Mass General. Before joining the team, she worked as the Community Outreach and Education Manager for the American Liver Foundation as a member of both local and national staff. Lindsay's passion for supporting people with liver disease arises from her own experience as a patient with hepatitis C and as a caregiver for her mother before, during, and after her life-saving liver transplant. In recognition of Hepatitis Awareness Month, she joins us today to give a talk on viral hepatitis. So please join me in welcoming Lindsay.
Thank you so much, Amy. I'm going to just share my screen here. As Amy said, please do, ask questions as we go through. I really would love this to be, interactive. We'll open up for questions towards the end. But in the meantime, write them down, jot them down, and we'll get to them. So as Amy indicated, this is Viral Hepatitis Awareness Month. So we're going to discuss viral hepatitis. I'm going to highlight the most common forms of viral hepatitis that we have in the US, which are hepatitis A, B, and C. I will briefly talk on some other ones, but we'll really spend most of our time talking about A, B, and C. All right, so hepatitis, this word is shared a lot. Most people think hepatitis and think of a virus like a hepatitis A, B, or C, but truly hepatitis just means inflammation of the liver. Hepa is the prefix for liver, so your hepatologist is your liver doctor. A hepatocyte is a liver cell. So hepa, H-E-P-A, we're talking about liver. And itis just means inflammation. So any sort of itis in medicine refers to an inflammation. So appendicitis is inflammation of the appendix. Bronchitis, where you get a really sore throat, is inflammation of your bronchi. So really just to think about that word hepatitis is only meaning inflammation of the liver. Some examples beyond viral hepatitis are things like autoimmune hepatitis, where there's a dysregulation in the immune system resulting in that inflammation. Steatohepatitis, which is inflammation from fat. This may be caused from alcohol-related steatohepatitis, ASH, or non-alcoholic steatohepatitis, NASH, and then a viral hepatitis. So what we'll be talking about today. A lot of acute or short-term viral hepatitis shares a lot of the similar symptoms. So I'd just review those really quickly. Folks might experience some jaundicing, which is yellowing of the skin or the whites of the eyes, a loss of appetite, upset stomach. This could be throwing up, stomach pain, or diarrhea. And then fever, joint pain, and feeling tired are pretty common complaints when it comes to viral hepatitis, as well as like an autoimmune hepatitis or a steatohepatitis. So as we think about the symptoms of these different viruses that we'll discuss, those are pretty prevalent in most of these different infections. So why do we care about inflammation? Why are we worried about hepatitis? Inflammation is really the driver behind the progression of liver disease. Most liver diseases progress in a similar way. So first, you have this injury to the liver, which causes inflammation or hepatitis. Just like when we get an injury or a cut to our skin, I got a small boo-boo the other day. First, it becomes inflamed and then it scars. That's the way that our body heals. And the liver is not exempt from that. It heals in a very similar way. So first, you have this injury, you have the inflammation, and then scar builds. If the injury resolves and inflammation is not continuous, the liver will go back and be healthy again. It's a really resilient organ. If, however, that inflammation is continuous, so say you have a virus that is causing this frequent inflammation of the liver, more and more scar tissue or fibrosis will develop. And over time, that can lead to cirrhosis. I actually have these neat little models. So this is showing the liver, which is right here up under your right side rib, and how that damage happens. So, first you might have a couple little scars here and there. That's a stage 1 fibrosis. Stage 2 fibrosis, we're starting to see those scars snake out a little bit more. They might start connecting to one another or band. At stage 3, we're starting to see a lot of connection or septa between those scar tissues. So they've snaked out so far, they're now almost creating these nodules, these little bumps and lumps on the outside of the liver. So stages 1, 2, and 3 of fibrosis are reversible. So as you'll see in this image, if you were to put treatment, provide somebody treatment, cure the underlying liver disease or calm that inflammation, the liver is incredible and can regenerate back to that healthy liver again. It's when we step into stage 4 of liver damage that we're talking more about cirrhosis. And at that point, damage can become irreversible. So somebody with cirrhosis is going to experience a whole host of complications, especially as their liver becomes more and more scarred or struggles to do its job. Somebody might develop ascites, which is a big fluid-filled belly. All the stuff that should be flowing through your liver can't get in, so it can kind of back up and pool in the abdomen, causing this big distension, big belly. Some people might have swelling in their legs or for a similar reason. Some people experience hepatic encephalopathy or a mental confusion as a result of their cirrhosis. This is due to all of the toxins your liver should be destroying. They're just not getting in to be broken down. They can back up and cause this almost dementia-like symptom called hepatic encephalopathy or HE for short. Some folks may start to experience internal bleeding because, again, the liver just is not processing all the blood and stuff that it needs to get through on a daily basis. And that blood can back up into the esophagus or the digestive system and cause bleeding. Somebody with cirrhosis is also at a really high risk of developing liver cancer. So if somebody develops cirrhosis, they will probably have to undergo liver cancer surveillance. This tends to be an ultrasound every 6 months or so. There is an exception to this, which we'll talk about when we get to hepatitis B, but it's not uncommon. It's really actually uncommon for folks to get a liver cancer, a hepatocellular carcinoma, when they don't have cirrhosis. It's much more likely to have a liver cancer arising in the background of cirrhosis. So this is kind of the progression of liver disease, whether we're talking about a virus or we're talking about lifestyle-related non-alcoholic fatty liver disease or alcohol-related liver disease. The liver is going to get damaged in the same way. So hepatitis, swelling, fibrosis, scarring, cirrhosis, extensive scarring, and liver cancer. So just a quick overview and about some of the concepts we're going to be talking about. Thankfully, we're all kind of prepped and primed to think about viruses and antibodies and vaccines because we've been living in this viral pandemic for the last couple of years. So hopefully this isn't brand new to you. But virus is really just a piece of genetic material, whether it's a DNA or an RNA that's encapsulated in a protein. So you'll see down here, I have pictures of the hepatitis A virus, B, C, D, and E. Very different viruses. They hold DNA, they might have RNA, but basically these viruses enter our body and go into a healthy cell where they'll replicate and multiply, create more different, more copies of itself, and then kind of spread out into the body. Different viruses kind of attract different types of cells. So COVID, that's getting into our lungs, that's in our respiratory droplets, that's where that virus lives. A viral hepatitis is a virus that attacks a liver cell. So if these viruses get into your body, it's going to go straight to the liver, and that's where it's going to do its replication, but also where it's going to produce damage. Hepatitis A and E, these tend to be acute infections. Acute, think about cute little, acute are short-term infections. They tend to be about 6 months. Your body will resolve it on its own. You may experience those symptoms we talked about, jaundicing, really getting sick to your stomach, bad fatigue, but they will resolve within that 6 months of catching the virus. Somebody who has an acute infection can still pass that along, just like any other virus, whether it's the flu virus or the coronavirus. And so hepatitis A and E fall into this acute form. whereas hepatitis B, C, and D, these can be acute and chronic. So some people may have an acute infection of hepatitis B or C or D, but then our immune system can kind of resolve it, get it out of our system, and you don't really have to worry about it again. A chronic infection is when it becomes lifelong. So it lasts longer than that first 6 months of catching it, and will likely need medications to cure or to manage it. Hepatitis B, C, and D, like I said, can be both acute or chronic. So we'll kind of talk about what those things are. So a little, just because I will be focusing on A, B, and C today, I wanted to give a quick overview of D and E. Hepatitis D is spread in a very similar way to hepatitis B, which we'll get into, but it's transmitted through infected blood, unprotected sex, or unsterile or contaminated needles. It can pass from a mother to a child if she's infected. It is only possible for somebody to have hepatitis D if they have hepatitis B. So whether they get both viruses at the same time, they're exposed to both B and D simultaneously, or they get hepatitis B and down the road, they develop, they contract hepatitis D. Hepatitis D needs hepatitis B in order to replicate and do its thing. If somebody has both hepatitis D and hepatitis B, it can really result in more serious and rapid liver damage. So it's really important to be aware of that co-infection and manage it as well as you can. A hepatitis B vaccine can prevent hepatitis D because, again, hepatitis D relies on hepatitis B. So if you can't even get B, you're not going to get D. Hepatitis E is very similar to hepatitis A, where it's transmitted through contaminated water or food, particularly pork and shellfish, and it can be transmitted via blood. There's no chronic infection associated with hepatitis E. As I said, it's that acute short-term infection. There isn't a vaccine in the US. There is one in China that they've produced and licensed, but currently there isn't one here. And there is no drug treatment for hepatitis E, as it will kind of go away on its own. So again, that's just a kind of down and dirty quick review of D and E, and we'll get more into the nitty gritty of hepatitis A, B, and C. Some more quick kind of terminology concept reviews. An antibody, this is something that our body makes. So whenever our body sees something that doesn't belong there, a fungus, a bacteria, a virus, our immune system recognizes it as this invader and attacks it. That attack comes in the form of an antibody. They're very specific to viruses. So you would have a flu antibody, a common cold antibody for a particular strain of that cold. And it's stored up in your body, almost like a library, so that if that invader shows up in the future, you already have this host of army antibodies ready to attack that invader. Some antibodies result in immunity. So, with the COVID vaccine, for example, if we have those antibodies prepped and primed, we can fight it off and avoid getting sick or extremely sick, and prevent that chronic infection. Not all antibodies provide that immunity. So some viruses you can catch over and over and over again, even though you have those antibodies. So remember, an antibody is something our body creates in response to a virus. And it's actually in response to an antigen. So an antigen is a marker of an invader. It's one of those small proteins kind of on the outside of the viral shell. And your body recognizes it and says, oh, I have this antibody against this particular antigen, so I'm going to release the correct antibody to fight it. Antigens are also used by the immune system to create that antibody. So it's kind of a back and forth. So just remember, antibody is made from our body, antigen is from the virus. And then a vaccine, vaccines imitate an infection that can cause an illness. It teaches your immune system about invaders that may be coming at some point. And you may become infected with, and it works with your natural immune response to create those antibodies and to really safely develop that army. So whether it's something like the mRNA vaccine that was developed for COVID, where it's kind of giving the cheat code to your immune system to say, hey, this is the markers that you're going to look out for, or something where they take the actual virus and make it non-infective and share that with your immune system that way. So there are different types of vaccines, but they're all kind of prepping and priming your immune system to recognize an outside invader, something that doesn't belong. So when we talk about hepatitis A, this is a short-term, quick infection, not quick, but it's an acute infection. It's that first 6 months. Folks can contract hepatitis A and not necessarily feel sick. Adults are more likely to feel sick from this virus than children are. Infection can be spread from one person to the other before they develop any symptoms. Symptoms can appear about 2 to 7 weeks after infection. So say you become infected, you don't start feeling sick until 3 weeks later. In that 3 weeks, infection can still be transmitted from one person to the next. So where is hepatitis A? Just like the COVID virus only lives in our respiratory droplets. So that's what we've been very conscientious about the last couple of years. Hepatitis A only lives in blood and stool. It can be transmitted via contaminated surfaces. So say there is a little bit of fecal matter on or blood on a surface, it can survive for months outside of the body. It can be killed by high temperatures. So boiling or cooking foods or liquids for about 1 minute will kill the virus. Freezing temperatures will not kill hepatitis A. And risk factors, we're really thinking about eating or drinking contaminated food or drink. So a lot of times when we think about a hepatitis A outbreak or the presence of hepatitis A here in the US, it's usually traced back to like a restaurant or something like that, where maybe a worker who's at that restaurant has hepatitis A, does not properly wash their hands after going to the bathroom, and then serves food. That can cause a hepatitis A outbreak. That's not unheard of. Several years ago, I know California was experiencing a massive hepatitis A outbreak because they had really high levels of folks experiencing homelessness without a lot of proper facilities. So people were going to the bathroom in the street, which was resulting in high spread because you have those contaminated surfaces. So you may have hepatitis A living outside of the body. Bleach does kill hepatitis A as it does most viruses. So in California, what they ended up having to do was kind of spray the streets with bleach to quell that outbreak. Another risk factor can be having close contact with an infected person. So having sex with someone, caring for someone who is sick, or using drugs with someone who has hepatitis A. Sorry about that. So for diagnosis, it's diagnosed through a blood test. It's really the only treatment is how we treat a lot of kind of short-term infections: rest, good nutrition, fluids. It's not super common for somebody to end up in the hospital with hepatitis A unless they have something else going on. They may get very dehydrated and need to go to the hospital, but usually this is something that will resolve in about 2 months, but it may last up to 6 months, but it will not be one of those lifelong infections. When it comes to prevention, say you work here at the hospital and you're aware that you were exposed to hepatitis A and you don't have a hepatitis A vaccine, if you see a doctor within 2 weeks of an exposure for a dose of hepatitis A vaccine, it can prevent you from getting sick. More prevention, hand washing, which we're all kind of ready to do and well trained at. Eating food prepared in a sanitary way, so making sure that you're eating in a nice, clean restaurant or at home and preparing properly. Getting vaccinated if your state has an outbreak. Massachusetts did have an outbreak that resolved in about 2020. So I'll kind of present those numbers to you. But I think it's a good practice to get vaccinated against a virus such as this, particularly if you have another liver disease going on, because you don't want to add insult to injury to your liver. Never sharing equipment to use drugs, and only using fresh, clean water for drug injection. So a lot of the outbreak that we saw here in Massachusetts was tied to intravenous drug use. Folks were using sometimes dirty toilet water or something like that, where they were getting infected with hepatitis A in that way. And then using a barrier for oral and anal sex. It's a fecal to mouth transmission. So if there's any kind of risk for that, just making sure you're being a little extra cautious. Vaccination for hepatitis A is recommended for children under a year. It's much more likely that a small child's going to come into contact with fecal matter than an adult. Folks who are traveling internationally, so there are other countries where they see higher rates of hepatitis A, so it is encouraged to for folks who travel a lot internationally to get a hepatitis A vaccine. Anyone who has contact with someone who has Hep A, men who have sex with men, people who use or inject drugs, as I said, anybody who's living with a long-term liver disease like hepatitis B or C, and then folks experiencing homelessness. Just because, again, close contact, small facilities, there's a kind of, when you get into that congregate setting, whether it's a detox facility or a homeless shelter, it's a lot closer contact in terms of living. So minimizing that risk is really important. So hepatitis A in the US, as I said, this vaccine was developed and approved in 1996, and we really started to see a decrease in cases of Hep A following that approval. However, in 2012, cases did begin to grow and continue to grow throughout the states. And there are a lot of different outbreaks across the US. As I said, Massachusetts had its own outbreak from 2018 to 2020. It did end in May 2020. And the populations most affected were people experiencing instability in housing or homelessness, and folks with substance use disorder. So to kind of give you a sense of the increase, so we went from 53 cases in 2017 to 563 outbreak cases between 2018 to 2020. 9 deaths were related to those outbreak cases. It's pretty uncommon for folks to get that sick with hepatitis A unless they have some other underlying condition, whether it's a liver condition or their health just is not as healthy at baseline as somebody else. We did see a lot of these cases occurring in folks who use drugs. The kind of rates of known drug use and known injection use were really clear risk factors within this outbreak. But it is really important to be aware, be conscientious of your risk factors, and try to prevent as much as possible. So that's kind of a quick review of hepatitis A. Hepatitis B, this virus can go chronic. It's more likely for folks to have an acute experience, but we'll talk about kind of what those differences are. But 40% of people with acute Hep B will have some symptoms. So not everybody, more people will be asymptomatic or without symptoms and will have symptoms. Most people with chronic Hep B have no symptoms at all. That's why testing is really, really important when it comes to hepatitis B and C, because these can be chronic infections that do, put your liver at a great risk, and can be managed. But you won't necessarily know. A lot of folks, unfortunately, don't know they have one of these viruses until they start experiencing symptoms of cirrhosis. So that big belly or jaundicing really severely, or internal bleeding. 66% of people throughout the US who have hepatitis B do not know they're infected. So again, testing is really the best way to be sure what your status is. If symptoms do appear, they appear about 90 days after infection. But again, you can transmit the virus before feeling symptomatic. So where is hepatitis B found? It's in most of our bodily fluids. So it's in blood, semen, saliva, breast milk. It's in most of our bodily fluids. It does survive for at least 7 days outside of the body on a contaminated surface. The best way to clean this up is a mix of bleach and water. So 1 part bleach to 10 parts water. And when it comes to cleaning up a blood spill or a bodily fluid spill in a preventive type of way, you really want to scrub it. You can't see 1 red blood cell with your naked eye, and it can just take that one. So making sure that you're really being diligent about using bleach, the right cleaning supplies to make sure that you're killing the virus and making it ineffective to make you sick. Most common risk factors. So the way that you would get hepatitis B is how the infected bodily fluids would enter the person who's not infected. This can occur, we call it vertical transmission. So at birth, the mother to the child. That's a risk factor. So if somebody has a parent with hepatitis B, birth mother, they should be checked. Sex with an infected partner, it's more likely to have a sexual transmission of hepatitis B than it is something like hepatitis C. Sharing of needles, syringes, or any other drug preparation equipment, even if that's a spoon or cotton, truly anything involved in intravenous drug use should be one-time use, disposable, sterile, and individual. And then sharing of personal care items. So toothbrush, razor, nail clippers, glucose monitor, anything that might get a little blood on it, making sure you have your own and nobody else is using it and you're not using somebody else's. Because, you brush your teeth, your gums bleed, you pass it on to somebody else. That could result in a transmission. Direct contact with the blood of somebody who is infected. So, here at the hospital, if you're exposed to somebody who has hepatitis B, being aware that that is a risk factor, or being stuck by a needle or another sharp object that's infected is also a risk. So this is diagnosed through a variety of blood tests, which I'll talk about briefly. When it comes to an acute infection, there is no medication. It's managed the same way we manage hepatitis A, with rest and fluids. Symptoms can last weeks or up to 6 months. But if the virus will resolve on its own, it's going to do that in that first 6 months. Chronic hepatitis B is not currently curable. It is manageable. We can provide medications to slow the progression. There are currently clinical trials going on to kind of explore cures for hepatitis B, which is really exciting. And we're hopeful to find something soon. When it comes to prevention, just like you could get that one dose of the hepatitis A vaccine and prevent an infection there's a similar kind of prophylactic vaccine delivery that they do for hepatitis B. So if you're exposed to hepatitis B and you see a doctor within 24 hours of that exposure, you either get a dose of the hepatitis B vaccine or a shot called HBIG, which is the hepatitis B immune globulin, and that will prevent the virus from kind of taking seat and infecting you. Vaccination is huge when it comes to hepatitis B. Because this is not a curable virus, prevention is huge. So if we can prevent it in folks, we can really quell those numbers a bit. Hand washing and properly cleaning up any bodily fluids is very important. Wearing a condom with sexual partners, because remember, it is in those sexual fluids. It's going to be in semen or vaginal fluid. Never sharing equipment to use drugs, marking your own, making sure that, you're trying to use those one-time single use. And then if a baby is born to a mother with hepatitis B, it's much more likely that a baby or a small child will develop a chronic lifelong infection than it is for an adult. So what we do is we give an infant born to a mother who has hepatitis B that HBIG, the Hep B immune globulin shot, within 12 hours of birth, and that will prevent that baby from getting infected. So being aware of your status as a mother and making sure that that's being communicated to your doctor. When it comes to vaccines, truly anyone who wants protection against the hepatitis B vaccine should receive one. All infants do get them. It's called a birth dose initiative. So it prevents, younger and younger infections. Children younger than 19 who aren't vaccinated should be vaccinated. Anyone traveling internationally, and then anyone who's at risk for infection through sex or has a sexual partner with hepatitis B. Anyone at risk through exposure of blood, so folks who inject drugs, people who work in healthcare settings, or public safety, people on hemodialysis or people with diabetes. Remember, if you're sticking your fingers all day, every day, there's an open route for blood to get into your body. So it's just important to recognize where there might be possible risks. Anyone who has hepatitis C or another chronic liver disease should have a hepatitis B vaccine. You don't want to add insult to injury. Folks with HIV, again, that's just going to kind of accelerate the process. And anybody who's in jail or prison, just to prevent any kind of risk to yourself or others, and trying to minimize the risk in that congregate setting, because that's where we do see things spread a little bit faster. So I know I said earlier that the way that liver disease progresses is from hepatitis, swelling, fibrosis, cirrhosis, liver cancer. Hepatitis B is a little unique. Just having hepatitis B puts you at risk for developing liver cancer. So somebody with Hep B does not need to develop cirrhosis before developing liver cancer. So someone with Hep B will likely be undergoing similar liver cancer surveillance as somebody with cirrhosis. This generally means an ultrasound every 6 months or so. So who should get tested for hepatitis B? If you were born in a country with a high prevalence of hepatitis B, it's very important to get tested. Men who have sex with men should be tested. Anyone who injects drugs or has HIV. If you live with or have sex with somebody who has hepatitis B, or you're on immune suppressing medications, these things, either heighten your risk of getting it or heighten your risk of getting more sick. If you have kidney disease or hepatitis C, If you have abnormal liver function tests, your doctors will or liver enzyme tests, your doctor will probably check to see kind of what's going on and see if it might be a hepatitis B cause. Pregnant women should be tested for hepatitis B, so that way you can do that birth shot of HBIG to prevent the baby from being infected. Or if you were born to a mother with hepatitis B, you should be checked. So the testing, remember our terms: antigen, this is from the virus; antibody, this is from our body. So some of the different tests you may see if your doctor were to look for hepatitis B, you're going to see HBsAg. This is a hepatitis B surface antigen test. This is an antigen, remember, from the virus that can be detected in the blood when somebody has hepatitis B. It can't determine if you have an acute infection or a chronic infection. If it's positive, it means hepatitis B virus is present in your body and you can transmit it to other people. If it's negative, it means you do not have that virus in your blood. Antibody testing. So there's a couple different antibodies. There's the surface antibody, which will look on your lab report as anti-HBs. This is an antibody produced in response to the antigen. So this means that a person is protected or immune because they were successfully vaccinated or they had the virus and recovered. So if this is positive, it means, yep, at some point hepatitis B was in this body, whether it was from a vaccine or it was from the immune system or from the actual virus itself, but we've created this antibody and we're safe. If the total hepatitis B core antibody, which will show up as anti-HBC, this is an antibody produced only in response to the active hepatitis B virus. So, you get the antigen testing, it says positive, that means the virus is there. Similarly, the anti-hepatitis B core antibody means that a person is either currently infected or was infected with the virus, and more tests will be needed to determine if there's an active infection. So you see that surface antibody, more than likely it's going to say, yep, I'm protected because I was vaccinated. The core antibody says I am protected or may have an active infection because I saw the actual virus. So don't be very worried if you see that positive result. Look to see what is my doctor looking for and what does that mean for me. And if you have any questions, always ask your doctor. It's really important that we know what our doctors are looking for so we know how to better care for ourselves. So the current state of hepatitis B in the US and Massachusetts, again, just like with hepatitis A, we saw a huge decrease in cases once we successfully developed a vaccine. Same with hepatitis B. Once that vaccine became highly available, we saw a big decrease in cases. We have seen an increase in Hep B infections in a lot of different states that's pretty closely tied to the opioid epidemic and ongoing IV drug use. I will say Asian Americans and Pacific Islanders make up about half of the people living with hepatitis B in the US. There are much higher rates of hepatitis B in Asian countries. So it's important if you are of Asian descent or Pacific Islander to get tested for Hep B to find out your status and hopefully get treatment. In Massachusetts, we did see a small outbreak in 2017 in Bristol County. There were about 32 cases from that county, which was a 78% increase over the county's average. Most folks who tested positive in that outbreak had a risk factor of folks who inject drugs. Or they tested positive for hepatitis C. Remember, it is really going to add insult to injury if you have both an active case of hepatitis B and hepatitis C. It's presumed that most of the people who were involved in that outbreak in Bristol County were unvaccinated as children, but there is something called, vaccines work different for everybody. So not everybody's body takes that vaccine in and creates the right antibody. So that's why it's important for lots of folks to get vaccinated. So that way, even if I'm not only protecting myself, but I'm minimizing the spread. So I'm protecting somebody for whom that vaccine might not work. So just to give you a sense, we've stayed pretty consistent in terms of the cases here in Massachusetts, but we do see kind of these little pocketed experiences. So now we'll dive into hepatitis C. Folks who have acute Hep C usually have mild or no symptoms. Some people may have a heavier symptom load. Symptoms usually appear 2 to 12 weeks after exposure to the virus, but again, you can still transmit the virus even before feeling symptoms. Folks with chronic Hep C usually have no symptoms until they start experiencing those symptoms of cirrhosis. I can't tell you the number of folks who I've met who said, my liver function tests were always normal. Nothing was ever wrong with me. Then I started getting yellow and I got this big belly and my doctor told me I have cirrhosis and I need a liver transplant. Getting tested is the only sure way to know that you have hepatitis C. 40% of folks living with Hep C in our country do not know that they're infected. So we can really change those numbers if we can get folks tested and get them cured. So Hep C, where hepatitis A is going to live in blood and fecal matter, and hepatitis B is in most of our bodily fluids, hepatitis C only lives in blood. It can be spread through a contaminated surface. So unlike hepatitis B, which doesn't live quite as long outside the body, hepatitis C has a very long lifeline outside of our bodies. It lives in a really nice protective envelope. So hepatitis C virus can live up to 3 weeks on a surface. So say there was a blood spill on my liver model here, that virus can stay viable and could infect me up to 3 weeks after being deposited. In a closed, wet environment, like a needle, that virus can live up to 3 months. So it's very, very important to be very mindful of not exposing anybody to your blood or possibly exposing yourself to somebody else's blood. A mix of bleach and water is most effective, again, in cleaning up any blood spill. So 1 part bleach to 10 parts water. So the way that the virus actually spreads is that the infected blood from an infected person enters the bloodstream of an uninfected person. This is common in folks sharing needles, syringes, or other drug preparation equipment. Again, this goes to the spoon and the cotton and the water. Really, any part of that runs a risk of transmitting hepatitis C. Any sharing of personal care items, toothbrush, razor, nail clippers, tweezers, glucose monitor, anything that has blood on it. Birth, mother to child. So that's actually how I contracted hepatitis C. It's not super common. It's about 5% of babies who are born to a mother with hepatitis C are going to contract the virus in a long-term or chronic way, but it does happen. Sex with an infected partner. This would require a blood-to-blood transmission during sex. So hepatitis C does not live in vaginal fluid. It does not live in semen. It's only in blood. But if there is, an open wound on somebody and a blood exposure on the other person, there is a risk. Being stuck by a needle or an object that has hepatitis C infected blood on it, and then getting tattooed or pierced in an unregulated setting. So here in Massachusetts, we have great oversight of our tattoo parlors and our piercing parlors, but it's really important to consider when you go out of state that those regulations differ from one state to the next. Or if you're getting a tattoo at like a tattoo party or something like that, that's going to be an unregulated setting where you have to be a little bit more conscientious. So hepatitis C can only be diagnosed through a blood test. I'll talk about those testing. There is also a test that can be done. It's a rapid test. It's a quick finger stick. So you get a finger stick, you put a little blood in the test, 20 minutes later, you have a result. What that is looking for is the antibody. So remember, an antibody comes from us because the virus was in us at some point. So if you have a rapid test, you get that quick finger stick 20 minutes later. If you are told that it's positive, that means at some point you had hepatitis C, you have that antibody, but it doesn't mean you are actively infected. So more testing is required to determine that. And I'll talk about that testing. So what is most exciting when it comes to hepatitis C is where we don't have a vaccine, we do have a cure. So when I had hepatitis C, it was about a 30 to 50% chance that the medication they gave me was going to work. I had to inject myself once a week. I was very, very sick for a full year. I had to take 6 big pills every day. Now treatment is generally 1 pill once a day for 8 to 12 weeks. Most folks can be cured in about 8 weeks, and side effects are minimum. Most commonly reported is headache. I mean, it's truly miraculous that we have gone from, just first naming this virus in the early 90s to now being able to cure it, and to cure it in most people. So over 90% of folks can anticipate being cured. So when it comes to prevention, hepatitis C antibodies are not protective. So I had hepatitis C. I was successful in clearing it in 2008. If I were exposed to it today, I would reinfect myself. So you can always catch hepatitis C again. There's no vaccine, there's no immunity to it. So prevention is huge, kind of reducing your harm. So using sterile injection equipment, avoiding reuse or sharing. If you have to reuse, mark your own equipment so that there's no possible risk of using somebody else's. If you have to share, bleaching it. And a lot of our safe injection, needle exchanges and detox centers and harm reduction programs here in Massachusetts will be able to provide information to you about that. But we do have so many clean needle exchanges. It's huge to really use that one-time use. Avoid sharing straws for snorting drugs or crack pipes. So, if there's any bleeding or risk there, intranasal use is a risk. So if you've ever used intranasally or if you've ever used injection drugs, it's really important you get tested. When it comes to tattooing and piercing, sterile one-time use. So no piercing guns, making sure it's a single one-time use needle. When it comes to tattooing, make sure you see your tattooed artist set all that stuff up in front of you. Watch them pour out that ink, because if they're reusing ink, there's a risk that you could contract a virus like this. Avoid sharing toothbrushes, nail clippers, tweezers, razors. Using condoms and lubricant to reduce any risk of blood being present, and getting tested. If you know your status, you know how to protect other folks. I was diagnosed with Hep C when I was about 10 years old, and my mom thankfully taught us really well how to protect other folks. I would even go so far as to, if I used my sibling's toothpaste tube, I would just use my finger to put it on my toothbrush instead of wiping my toothbrush over. I will say I grew up in a house with 6 people. 3 of us had Hep C, 3 of us didn't. The folks who had Hep C never got it from us. We were careful, we were conscientious of our blood. But again, it takes the infected blood of the infected person entering the bloodstream of the uninfected person for transmission to occur. So testing, unfortunately, this was a huge effort locally as well as nationally. And the American Liver Foundation really fought hard for this as well, to get universal testing. So we do universal testing for HIV. We now have universal testing for hepatitis C. So every adult should be tested for hepatitis C at least once in their life, regardless of any risk factors. Every pregnant woman should be tested every pregnancy, and anyone with risk factors should be getting tested regularly. So I briefly talked about the antibody test. This says you've been exposed to the virus. At some point it was in your body. I got rid of the virus in 2008. I still have the antibody. I'm always going to have it, but it's not protective. Say I had a risk factor yesterday and I test negative today. It can take 3 to 12 weeks for those antibodies to show up in your blood. So it's important to kind of consider your last possible risk factor and do a little math out to make sure you're getting tested appropriately. So about 1 in 4 people will get rid of this virus on their own, meaning they will have a positive antibody test and a negative viral load test. So they were exposed, but there's no active virus. The viral load test looks to see, is there virus currently in your body? It looks for the actual genetic RNA material of the virus. If it's positive, the virus is present, the person has hepatitis C, they can spread it, and they need treatment. If it's negative or undetectable, that person doesn't have hepatitis C, they cannot spread the virus. There is no such thing as dormant hepatitis C. And then some other tests might need to be done to determine really what medication is best for you and how long you might need to be on it. A genotype test figures out which strain of the virus you have and which treatment will work for you. And then you may also get a fibroscan or an ultrasound, or in some rare cases, a liver biopsy. We used to always have to do a liver biopsy, which is where they take a needle, they go through your ribs and take out just a small portion of cells. It sounds a lot scarier than it is. FibroScan or ultrasound is a non-invasive imaging test where they can really kind of look at the liver. An ultrasound is going to look at it just the same way we look at a baby to see what's going on. FibroScan can tell you how much scarring has developed based on how dense your liver is. So those are quick, simple tests covered by insurance to really kind of figure out where are you in this progression, because there is no set timeline to say you'll have inflammation for this long, fibrosis for this long, and cirrhosis for this long. It's very individual and is influenced by, how well are you eating? How well are you taking care of yourself otherwise? Are there any other risk factors to your liver's health? So when we think about Hep C in the US and in Massachusetts, Before 1992, we didn't know what Hep C was. We didn't know to screen our blood supply for it. We didn't have a test for it. So folks were getting tainted blood transfusions or organ transplants. Widespread screening of the blood supply has happened and continues to happen. And that's really kind of eliminated that source of infection. But a lot of folks did get tainted blood transfusions. For a long time, this virus was considered a baby boomer disease. Baby boomers, folks born from 1945 to 65, were at really had higher rates of hepatitis C than other folks. And a lot of that kind of boils down to what we didn't know about blood. We would reuse syringes. I mean, I've heard some horror stories from boomers that really there were more everyday type risk factors than we see now. In 2018, however, new infections reported to the CDC were 4 times as high as they were in 2009. And we saw kind of a shift from this baby boomer to this younger generation. And it was really tied to the opioid epidemic. As we all know, Massachusetts has been a very hard hit state when it comes to the opioid epidemic. So we have seen more cases here, but thankfully we have great healthcare here and open access to the medication. So each state differs on how they'll treat, when they'll treat, how they'll treat Hep C. But here in Massachusetts, you do not need to establish sobriety. You do not need to have advanced liver damage to get treatment. You can get treatment when you're ready and when you need it. Just kind of a few final thoughts. You can please start sharing your questions in the chat box and we'll spend the last 12 or so minutes going over them. But please make sure that you're receiving those routine liver cancer surveillance tests. That's really the only way to pick something up as soon as possible. Tell your doctor about every medication you take, whether it's something you've been prescribed. You want to make sure that prescription list is complete, but also any over-the-counter meds you take, NyQuil, Dayquil, Benadryl, Tylenol, ibuprofen, anything at all, tell your doctor. We don't know really kind of all the mixing and mingling of those meds in our body and how it's going to affect our health. So it's really important your doctor is aware so that they can help you balance the risk benefit. Talk to your doctor about herbal supplements and vitamins. We think, it's all organic. We can buy it over the counter, no big deal. There are a lot of herbal supplements that can hurt our liver because our liver processes so many different meds and all of these different vitamins. So it's really important to tell your doctor about it, even if it's writing it down and bringing in a list. Trying to maintain a healthy weight and following a healthy diet, balanced diet, kind of the classic fruits, veggies, grains, protein, trying to minimize as much processed foods as you can. This is going to just help your liver be healthy and happy overall. Trying to minimize or eliminate alcohol if you do have viral hepatitis is really big. Our livers hate alcohol, so as much as you can kind of minimize that, that's huge. If you have an active substance use disorder, trying to address that and get some assistance, and then talking to your doctor about any treatment options or testing. There are a lot of different clinical trials at MGH for, particularly hepatitis B. So if you're interested, you can always talk to your doctor. And make sure that you're getting reliable information. Since the advent of the internet, Dr. Google kind of is the quick diagnostic go-to for us. It doesn't usually help us. It usually leads us down a rabbit hole. So as I said, I worked at the American Liver Foundation. They are an incredible resource. They helped my family tremendously prior to transplant. So I'd encourage you to check out their website, liverfoundation.org. They also have a helpline that is really well staffed. CDC, the Mass Department of Public Health has good info, National Institutes of Health, and the VA, the Department of Veteran Affairs. So I really appreciate you all for coming today. I am going to stop my screen share and we'll get to these questions.
Thank you so much, Lindsay, for a wonderful presentation. We are now at the end of the session, so if you have any questions for Lindsay, feel free to enter them in the chat box.
All right, so it looks like the first question is, which vaccines do we usually receive growing up, and do they provide us lifelong, or should we get boosters? So you can, and can we know if we got a blood test or not? So their hepatitis A and B is generally recommended for most folks in the US. We've more recently started doing Hep A vaccines in kiddos. So that's one you might want to check on. You can get a blood test. So I used to go into detox centers a lot. And when the Hep A outbreak was happening, I called my doctor up and I said, I know I got a Hep A vaccine, but can I just make sure it's still doing its thing? It's called a titer. Your doctor does a quick blood test. They make sure you have that antibody. Remember, that's something we make. And they make sure that it's there and doing its thing. Boosters are not uncommon. So particularly with the hepatitis B vaccine, it's not uncommon for folks to need a booster to kind of bring you up to that protective level. So if you have kind of a risk factor that you're aware of that's kind of ongoing, it's not a bad idea to get it checked every so often. So hopefully that answers that question. Another question is, can household bacterial wipes, antibacterial wipes on hard surface kill hepatitis? If so, which ones? Every single cleaning supply that you purchase, I wish I had one here, lists out on the back what viruses it will kill. It'll say rhinovirus, COVID-19, flu, common colds. So just look at it. If it says HBV or HCV, those are going to be the shortened versions of hepatitis B and hepatitis C. I think there are some, but I always say it's better to just double check and know that bleach-based cleaners in that ratio we talked about, 1 part bleach to 10 parts water, is going to be the most effective. Oh, also, I did see this on the news. There was a recent unexplained hepatitis in children. There were a couple cases here in Boston. I think there's about 78 or so across the US. And should it be something that parents be worried about and signs and symptoms to look for? So I did see this. It doesn't seem that these are related to a viral hepatitis. So basically these little kiddos are showing up with some symptoms, that jaundicing, the yellowing of the skin, fatigue, maybe some pale stools or tar-like stools. And so those are indications of the liver being inflamed, but not necessarily a virus. So like I said, the symptoms of autoimmune hepatitis are going to be similar to the symptoms of a viral hepatitis. So this definitely seems to be something that's inflaming children's livers, but we don't really know the source. So they're looking and trying to figure out, there does seem to be one common virus in a majority of cases, but that's not related to the ones here locally. They don't think it has anything to do with the COVID-19 vaccine. They're really trying to kind of, do almost like a Dr. House and figure out, what's the cause here. So I would just say keep signs on kids. If anybody has children, newborn jaundice, yellowing of the skin in a newborn is not uncommon. That comes from a vitamin D deficiency. So, kids will either need a vitamin D supplement or get one of those little sunlights to kind of up the vitamin D and reduce the jaundicing. It's when that jaundice appears not immediately after birth or is kind of long-term and doesn't seem to be resolving that you're going to want to talk to your doctor. But it sounds like there's not a ton that parents should be doing or actively not doing to avoid the development of that kind of unknown hepatitis in these kiddos.
Thank you, Lindsay.
Yeah, of
Do
course.
you mind telling us a little bit more about programs and services offered at Mass General for hepatitis?
Absolutely. So the Liver Center and the Infectious Disease Clinic are great sources for folks who have a viral hepatitis infection. You can get kind of maintenance treatment here as well. There are a lot of different clinics if you're not a patient of MGH, different community clinics too that can manage these things. And I think educating yourself is really big. I'm really grateful that the Blum Center is doing a program like this because truly the more you know, the better able you are to look after your own health. My hepatitis C was thankfully cured in 2008. My mother did go on to develop liver cancer and need a transplant. And so these are really serious viruses and these, but they're manageable or curable, which is really the important takeaway today, I hope. Preventing what we can prevent with vaccination, managing what we can with hepatitis B, and curing hepatitis C as soon as possible. Because truly, since we don't have that vaccine for Hep C, if we can get folks cured, we prevent spread. So really trying to get engaged in treatment as soon as possible, and making sure that you feel compatible with your doctor. I think it's, I know it's silly to say, but I like to equate finding a good doctor as like finding a significant other. It's not necessarily going to be the first one you meet who you jibe with, but making sure that you feel like you can be open and honest about any and all risk factors with your doctor, because if they don't know your risks, they can't take care of you properly. And they're not asking for, to judge or anything else. It's really to be able to look after you and your health in a collaborative way. So I would encourage everyone to take an active role in your care team, to really make sure you feel comfortable and safe with your doctor. We have awesome providers here at MGH. The liver center is great. I'm a little biased, but I think it's wonderful. But I think it's really important to just engage in care. And if your doctor says get that ultrasound every 6 months, I know sometimes co-pays can be limiting. There are so many different resources here at the hospital, financial resources, ways to navigate. So trying to get plugged into those and making sure that you're getting the care you need, and not allowing financial reasons to prevent that. There's various grant programs and things such as that. So making sure that your doctor knows kind of what your limitations are and see how they can support you in that way and beyond.
Thank you.
Yep.
While we wait to see if there are any final questions for you, is a referral needed to be seen at the Liver Center at Mass General?
I think generally, often that relies on somebody's insurance. So you can always call the liver center or the GI clinic, the gastroenterology clinic. So just a quick note between gastroenterology and hepatology. So gastroenterology is somebody who's going to look at the whole gut. They think about the liver, but they're also thinking about your bowels and all the rest. A hepatologist is a gastroenterologist who's gone one step further to specialize in the liver. So generally speaking, we would encourage folks to see a hepatologist or somebody within the infectious disease clinic at MGH. But it really depends on your insurance, but you can always give a call. And if for some reason you do need a referral, the staff is more than happy to help facilitate that.
And are you located on the main campus of Mass General in Boston?
Yeah, so the liver center is in the Wang Ambulatory Care Center. It's on the 5th floor. That's also where we do a lot of our research. So as I said, I'm a clinical research coordinator. We currently have a study going on for hepatitis B and hepatitis D co-infection, which is truly an unmet need in this world of viral hepatitis. As I said, I did interferon, which was a pretty toxic medication. It makes you feel real bad. It's like having the flu times 50 the whole time you're on it. And some folks who have that kind of a co-infection need to be on interferon for decades, which is just awful to think about. So I think it's really important that we keep innovating and keep finding new solutions and new treatment options for folks. And at the end of the day, getting tested is really what I hope you walk away from, because if you can get tested, you can get treated, and you can be cured of hepatitis C anyway, or managed when it comes to hepatitis B. So if you take nothing else away today, I just hope that we all go out and get tested, because had I not been tested when I was 10 years old, my hepatitis C would not have been discovered. I had no kind of traditional risk factors. So, I think it's just really important to consider getting tested so that you can at least know and kind of can move forward in that way.
Thank you so much, Lindsay, for an extremely helpful presentation. And thank you so much, everyone, for joining us today. As I had mentioned, today's session is being recorded. So if you're interested in viewing the recording, you may visit the Blum Center website at massgeneral.org/Blum-Center. Thank you so much,
Thank you,
everyone.
Amy, and thank you, the Blum Center.
Have a good day.
You as well.